Good afternoon. Time to bring you today's coronavirus update from Milwaukee County and city officials. Here's Milwaukee Mayor Tom
Staying at
Barrett.
home and socially distancing, that those are the keys that will unlock our ability to help us become a healthy community and at the same time allow us to restart our economy. So there are different components to this, as we've talked over the last 6 or 7 weeks. Staying at home is first and foremost the most important thing we can do. But I understand that there's a lot of pressures and there's a lot of concern where people are suffering from cabin fever. There are obviously huge economic concerns that we're facing. And we as a city are actively looking at ways to work with the funds that we have received from the federal government to see if we can utilize any of those funds to help people get back to work or help them with some of their basic needs. We're also looking at those funds to help us with some hazard pay, if you will, for some of the employees for the city of Milwaukee, because as you can tell, we are continuing to pick up the garbage and the recycling. And we want to make sure that we are recognizing the work that our employees in the Department of Public Works are doing to help us retain those things that we have as a community that we treasure. But earlier this week, we opened 5 sites that are community federally qualified health centers. And the whole purpose there is, of course, to expand our testing. The goal is to get to 2,000 tests a day. And they have the capacity to do roughly 350. I would say they started out probably pretty good on Monday, but we don't have the final numbers yet for the rest of the week. But I can tell you that we still have capacity for individuals who are showing symptoms of perhaps having COVID-19. Those individuals I would like to direct, particularly if you are on Badger Care or if you're not insured, that you would go to these healthcare clinics. They're located right in the heart of the city. 2 of them are on the south side. One is Ignis Health Center, the other is the 16th Street Health Center, and we have 3 of them on the north side as well. Those sites are there because we think it is important for our residents, particularly in the neighborhoods that have been hardest hit, that they have access to healthcare to determine whether or not they are testing positive for COVID-19. In order to do that, what we had to do was we had to work with these health clinics, and they have been incredibly cooperative, and they have been just wonderful. And they are going to have what we call a home, a health home for them, so that individuals who do test positive will have a place where they can do the follow-up, whether they're told either to stay at home or to self-quarantine, or what necessary steps are next after testing positive. The next step, of course, is the tracing portion. So before I get to that, I want to emphasize and put an exclamation point on the testing. We have the capacity at these federally qualified health centers right now to have more individuals tested. My goal, and the goal that has been set forth by the President of the United States, by the Governor of the state of Wisconsin, is to have even more testing. And in terms of the numbers that we want to reach here in Milwaukee County, a pretty rough barometer is about 2,000 cases a day. Right now, I would say we are probably doing closer to 3, maybe to 300 to 400. And Dr. Weston he probably has some fresher numbers on that. But I'd say that's basically where we are right now. So we still have the capacity to do that. The tracing is the next step that occurs. And the tracing really involves several processes. The first is the individual who tests positive will be contacted by, most likely, someone who works for the City of Milwaukee Health Department. You'll be asked a number of questions. We certainly honor people's privacy concerns as we ask these questions, but it's to gain more information so that you can put yourself in a place where you can be healthier. Part of that conversation is going to be asking you people that you have been in contact with. For example, who have you been in contact with over the last week and a half that you've been with for over 10 minutes and you've been within 6 feet of? That information is necessary because then a different group of people will be working with the city. Some of them will be people with health background. It's possible that they may not have health background, but they will be trained to do this. We'll be reaching out to those contacts so that we can determine what steps they need to take. One of the good things that's come out of the stay-at-home order is the number of those contacts has basically dropped. In other words, prior to the issuance of the safer at home order, you might have had 8, 10, 12 contacts that you had been concerned about. Now, because of this safer at home order, if you've been following it, those contact numbers will be smaller, and it'll be easier for our representatives from the health department to reach out to them. What we are doing right now in real time is we are expanding the group of individuals who are doing that tracing. We've got staff on the City of Milwaukee Health Department. We are utilizing assistance from the state of Wisconsin, and they've been wonderful in providing us with assistance there. There are times when we'll be working with suburban health departments, but that's the second step. Again, the first step is the individual is tested positive, they get contacted. The second step then is after that person has identified individuals who they have been in contact with, we do the tracing so that we can isolate them, which will allow us to contain the growth of the disease. All of these steps are necessary for us to be able to really do more of flattening the curve and getting us back to the point where hopefully by the end of this month, we'll be able to start reopening the economy. And the last thing I want to say on that is the sun is shining. It's going to be a nice weekend, and we're seeing the flowers starting to bloom. And the analogy that I like to use about us reopening the economy is think of it more in terms of a flower than as a light switch. A light switch, you just flip it right on. But the flowers that we're seeing right now, they're slowly coming out as their roots get stronger. They're slowly coming out of the ground. And what we want to see, and we want to see this with the flowers, and we want to see this with our community, by the time we get to summer, we want them to be blooming. I can't guarantee that, but think of that as more of an analogy as how this happens. Flowers don't grow overnight, and the economy won't be reopened overnight. But the more we can take care of what we need to do, the quicker we can get to the point where we all want to be. So with that, I want to turn it back over to Brian, and thank you all for sticking with us as we try to make Milwaukee a safer place.
Thanks, Mayor Barrett. And next we'll hear from Dr. Ben Weston.
Thank you, Brian. Good afternoon. So starting with the numbers, we have 3,115 cases of COVID-19 in our community and 180 individuals who have died. And as the mayor mentioned, we're hovering right around 500 tests per day, but seeing promising increases with expanded access. We did also see an increase in the number of positive cases on our dashboard. We're going to keep a close eye on these numbers to see if there's increased COVID-19 activity in our community, or if this may be a result of increased testing. Either way, I think it's an important reminder that COVID-19 is still present and still widespread in our community, and social distancing is as important as ever. This is particularly as important as the weather warms. Everyone's anxious to get out and enjoy, myself included. We've seen progress on flattening our curve and slowing the spread of disease and the rate of death. This progress has been due to the social distancing that everyone has been doing. And as we see the curve start to flatten, we must continue social distancing so as not to reverse our trends at this most fragile time. A single misstep could easily put us right back where we were a month ago. So when you go out and enjoy our parks, consider wearing a cloth mask to protect those around you. But remember that despite a mask, you still need to maintain that 6 feet distance from those around you. And if you don't yet have a cloth mask, you can find videos online, including on the CDC website for how to make one from materials at home. And if you're interested in making cloth masks for the community or are a community organization seeking masks, there's a number of resources out there, including maskupmke.org. Next, a reminder that if you have symptoms that are concerning for COVID and wish to have a test, as the mayor mentioned, you can call 211 and be directed to a community testing site. And these are organized by our community health centers. They're distributed throughout the region, and they're here to provide you with a simple, fast way to get a test. They've been receiving calls, but as mentioned, they have slots open for more patients in need to get tests, regardless of income, insurance, or immigration status. Call 211, and they'll help you to get set up with the test. Lastly, we've noted a decrease in patient volume in our 911 system, in our ambulance services, in our emergency departments, and in our hospitals. And while there's some health concerns that can certainly be handled at home, it's so important to not delay needed medical care. Our emergency and health systems are open, they're available, they're safe, and they're ready to help you with your needs. So if you're having shortness of breath, if you're having chest pain, stroke symptoms, or serious injuries, or other concerning symptoms, don't put your health needs aside. Don't delay them out of fear or out of misinformation. Thank you. Stay safe. And I'll hand it back to Brian. Or actually, I'll hand it over to Commissioner Kowalik. Thank you.
Thanks, Dr. Weston. Happy Friday, everyone. Happy May Day. I'll talk a little bit about May Day and the implications on employee safety for COVID-19 in a moment. But first, I want to acknowledge, as Dr. Weston noted, 180 people lost their lives to COVID-19 in Milwaukee County. Of that, 119 are in the city of Milwaukee. But unfortunately, we had an incident earlier this week where a domestic situation turned fatal. So we had our second mass shooting in our area since the beginning of the year. And I just want to talk a little bit about gun violence and how that's impacting our city right now and then before COVID-19. So Office of Violence Prevention continues to do critical work in our city as we tackle two pandemics at the same time. In addition to supporting families in need, they have been doing outreach to educate the community about the seriousness of COVID-19 and ensuring access to personal protective equipment with partnerships like Mask Up Milwaukee, which is also another opportunity to get free masks in our area. In addition to supporting families impacted by violence, they will also be working with our contact tracing teams to follow up with families that have lost loved ones to COVID-19. So this is one element of our Office of Violence Prevention and 414 Life. They provide supportive services to families that have lost loved ones. And we're looking at it from the perspective of there's some key ways to provide supports, linking families to services, making sure that there's trauma and mental health services, and just basic human needs provision. So we're seeing some overlap there, and we're going to leverage our 414 Life team for that. So today, our Office of Violence Prevention supported a community-led effort to provide care packages to the neighborhood where the mass shooting occurred earlier this week. Over 300 care packages containing personal protective equipment, toiletries, books, toys, and information about trauma support services, as well as domestic violence prevention, were provided in that area. So we wanted to thank Alderman Russell Stamper, ComForce, We Got This, Urban Underground, the Center Street Bid, and everyone else that came out to support today's effort. We send our love to the family and everyone else that was impacted by this tragedy. So again, we just need to acknowledge this is a tough time for many of us, and the message to stay home to save lives is very important, but we know that this is, adding to some of the initial situations of despair and lack of hope in our community. So we just want to, again, stress that help is available. There are a number of resources if you use our website, the City of Milwaukee's coronavirus website, or Milwaukee County, as well as using 211 as a resource if you're in need of services. So from that point, I want to pivot and talk a little bit about May Day. May Day is a significant day for the labor movement, and there's a lot of history about May Day and just the whole essence of labor movement here in Milwaukee and our Bayview community. So it's always nice to be able to reflect on all of the efforts of people that came before us and use that energy to move us forward. So I just, again, want to honor all of our essential workers and people that have really been working on the front lines since the start and even before our COVID-19 pandemic response. So it's important to acknowledge that there have been some situations where individuals have been exposed to COVID-19 just by going to work. And we've seen this in the news recently, even throughout the state. So what does that mean? So the health department has been aligning with the state guidance on what that means. So again, for long-term care facilities, if there is one case, that's considered an outbreak. And then for any other business, if you have 2 cases, that's considered an outbreak. So we are looking to provide guidance to businesses to make sure that they are upholding employee safety and making sure that that's a priority. Without employees, nothing happens. So this is not negotiable. There needs to be some additional supports to protect employees. So there's a number of resources I put in a chat box. The first one is the state's updated information on investigations by type of place. So if you click on that link, it'll show you the entire state, and it'll also organize it by region. So we're Southeastern region. It'll tell you how many investigations are going on right now by type. So it'll say long-term care facilities, food processing facilities, so on and so forth. So you can get a sense of what's really happening. They're not listing the names of those facilities. It's just giving you a sense of what's happening. There's also some updated guidance from the Morbidity Mortality Weekly Review, which is a very important tool for public health and healthcare professionals. It actually came out today, so I included the link here, but this is about meat and poultry processing facilities. And there's just some general information that's important to note for any business and how you can protect your employees from COVID-19. So it focuses on 4 areas: structural. So how are you maintaining physical distancing, period, while you're working, as well as during break time, the 6 feet apart from one another. And if any barriers are being used to protect employees, they should be used. Operational is looking at the production line, as well as any face or masks that are provided to staff, as well as heightened cleaning practices to disinfect and prevent the spread of COVID-19 in the workplace. Then there's social cultural. So it's making sure that you're educating the staff about any opportunities to prevent COVID-19. So again, there's many essential workers that speak various languages, so that whatever you're communicating needs to be mindful of that it's culturally appropriate and vetted by those individuals so that you're actually communicating clearly and the message is getting across. You're also looking at making adjustments for some cultural practices. There might be, birthdays and other types of forms of celebration that you're discouraging that, and again, educating staff why that's important to do so now since we're trying to prevent the spread of COVID-19. And then economics. So what types of incentives are you providing to employees, such as paid sick leave? And again, there's a federal opportunity for that. But we also know that there are other resources that employers can provide to make sure that employees are not feeling pressed to come into work or suppress their symptoms so they can get paid because they have to support their families, that employers are truly seeking to work with employees to make sure that COVID-19 is suppressed. So I just wanted to, again, highlight the importance of the labor movement again on May Day and essential workers, saluting all of the essential workers everywhere for all of the work that's happening. I know that this is a tough time for everyone. So with that being said, I'm actually going to follow my own advice and make sure that I'm taking care of my own personal health. I've talked about this before in different venues, that I'm someone that has disabilities, so I have to take some time away to make sure that I can better serve my community. So Tuesday I will be out for 2 weeks. So the deputy commissioners will cover while I'm out. So don't think I'm out because I have coronavirus or COVID-19. It's to handle my own personal health. So I'm very confident my team will continue to deliver updated information, credible information, and make sure that we're well represented through this COVID-19 response. So that is my update for today.
Thanks very much, Commissioner Kowalik. Next, we'll hear from Jen Francis, who's the Interim Executive Director of the Milwaukee County Parks Department.
Great. Thanks, Brian. Thanks for the opportunity to provide an update on behalf of Guy Smith and the Parks Department this afternoon. So we just want to share a few reminders as the weather warms up and park use picks up. So we know that we have a sunny weekend ahead, so that's good news. But we want to just send a couple reminders to respect your fellow park users when you're out and about in the park system, and just be mindful of maintaining good social distancing practices, the minimum of 6 feet apart. Plan ahead, be aware that bathroom facilities and indoor amenities in the park system will continue to remain closed at this time. We're also encouraging everyone to walk to neighborhood parks rather than driving to regional destination parks like the lakefront or other busy locations, traditionally busy locations. The county park system offers 15,000 acres of open space. So it's a great time to take advantage of exploring the lesser known parks that are closer to your home. We'd also ask you to be mindful of trash. And so if you can take home trash with you that you bring into the park, that would really help. Our staffing levels are significantly lower than usual right now this time of year. And your help keeping our parks clean can have a big impact on everyone using them, including supporting your park workers that are working hard to keep things clean for you. We also want to remind you that many facilities remain closed at this time. Playgrounds and fitness equipment stations, tennis and basketball courts, disc golf courses, dog parks and beaches, as well as I mentioned, restrooms and rental and indoor recreation facilities. You will also continue to see signs posted, particularly at playgrounds and basketball and tennis court facilities, reminding you of those closures. We ask you to please be mindful of those and respect those closures. They're for your own safety at this time. And additionally, parking restrictions will continue in certain areas, particularly along Lincoln Memorial Drive and the lakefront, as well as at some of our beaches, our beach parking lots. In more positive news, we were able to open 8 golf courses last Friday, and that was a great success. So Brown Deer, Dretska, Oakwood, Whitnall, Curry, Grant, Greenfield, and Lincoln have been open for the week and have been open since last Friday. We were really excited today to open up a few more courses. So we've now got Hanson and Warnemont added to the open courses, and Lake Park Golf has opened with the pay station. So those are open and ready for you to play. We're targeting a soft opening for the McKinley Marina next Friday, May 8th. And that will involve restricted access to facilities. So there'll be more news to come on that over the week, but that is in the works at this time. And so we're very eager to open up more facilities as it becomes safer to do so. We're continuing to monitor guidance from the CDC, the state, our local public health officers, the National Parks and Recreation Association, and the Wisconsin Parks and Recreation Association as well. So that kind of wraps up our list of reminders and safe tips for the weekend. But we hope that you enjoy the sun this weekend, enjoy the parks close to your home, and just take care of each other while you're out enjoying the outdoors.